Okay, good afternoon, everyone. It's just after 12, so I know people will be filtering in as we get going, but to honor our time, we're going to start right away. I am Kenya Desatel. I'm a COPA board member and chairperson of our Education and Advocacy Committee, and I am pleased to welcome you all to today's webinar on competitive bidding. This is COPA's second webinar of 2021. We strive to bring you unique and relevant information to our O&P community, in addition to advocating for the O&P profession at the state level here in California. As the first quarter of 2021 comes to a close, I'd like to use this opportunity to share some of the really great things that COPA has already been working on this year. We have remained diligent in our work to make an effective and meaningful impact within our California O&P community, not the least of which is within our Government Affairs Committee. Earlier this month, the COPA submitted a proposal to the State Senate Budget Subcommittee on Health to increase the Medi-Cal reimbursement rate for O&P services, something which has not been increased in over 25 years. The reimbursement and membership committees are making great strides to ensure we continually offer value to our COPA members, and the Education and Advocacy Committee is planning the next webinar as well as the beginnings of the Fall Education Symposium. We, like the most of the world, are hopeful that we can attain some sense of normalcy as 2021 progresses. So make sure to keep an eye on our website, californiaonp.com, for all your COPA news and some exciting announcements to come soon. I have the great privilege of welcoming our presenters, Mark Higley and Ronda Buhrmester from BGM and Associates. Mark is the Vice President of Regulatory Affairs. He analyzes governmental, regulatory, and compliance issues affecting the home care and DME industries. Ronda is Senior Director of Payer Relations and Reimbursement, specializing in review of claims, audits, and educates their members on medical policies and respiratory and DME products. Between them, they have extensive experience with previous rounds of competitive bidding, as well as working within the healthcare industry. We are truly ecstatic to have you both with us today for our webinar. Before we get started, just for our attendees, please use the chat feature to ask your questions as they come up, and we will moderate a Q&A session at the very end of the presentation, and I'll be rejoining then to help moderate that. Mark, Ronda, again, thank you for speaking with us today, and now the webinar is all yours.
Thank you so much, and I'm honored to come back to virtually. I wish we were back in San Francisco or someplace in California. This is the third year I've had the opportunity to speak to the fine individuals and associates of COPA. A little bit of background: the VGM Group Inc., of which Ronda and I are been longtime employees, represents a whole series of post-acute care via separate companies. One of them is our Orthotic and Prosthetic Group of America, to which we're honored to have hundreds and hundreds of O&P facilities as members. And we are in the government relations group. We are active in all advocacy efforts to support you. And we're just pleased to have the opportunity to speak with you today. Unfortunately, the topic today is not the best one in the world, but it has come to haunt the orthotic market, and that is the DME POS competitive bidding. It's been around virtually for 2 decades. It began with the Medicare Prescription Drug Improvement and Modernization Act in 2003, and it began virtually a decade plus ago for generally respiratory and traditional DME items. It was only until this latest round, as we call them. The rounds are 3-year increments, which began in 2009, of where suppliers that want to bill traditional Medicare fee-for-service, and again, I'll emphasize that, it does not affect Medicare Advantage Plans Part C, the restricted access to these patients. But it's been around for DME for quite some time. And so, again, there were several rounds, as we call them. They're over 3-year periods, which were not including any of orthotics or prosthetics. It expanded to diabetic testing supplies in a future round. And again, in this most recent round, which was round 2021, it added for the first time off-the-shelf orthotics. Now, the United States, for those of you that do not follow this closely, is made up of metropolitan statistical areas. What CMS did by its rulemaking authority is select 130 competitive bidding areas, which are generally a county or series of counties that due to the patient's permanent zip code, or for traditional Medicare, it is where the patient receives his or her Social Security check, or if it's an automatic deposit, the state of record. So it is not where the supplier of the orthotic service or of the respiratory service or of the mobility service is located. It is totally by the patient's home zip code. California is, which is obvious due to your heavy population, is one of the more, the greatest number of zip codes that are included within almost a dozen competitive bid areas. Compare that to Iowa. We have one part of Council Bluffs, Iowa, in the Omaha area. Most of California is covered by competitive bidding areas, which means for the off-the-shelf orthotics, of which I'm going to describe shortly, it is restricted for reimbursement to those companies that have received contracts from CMS via its contractor, and that contractor is Palmetto GBA. Across the United States, about 50% of the Medicare fee-for-service population, which would be 65 plus or disabled, resides in these areas. So it is a large footprint. And as you will see shortly, there are effects in California and other states that extend beyond these geographic limits of the competitive bid areas, of which I'll explain in a little bit. So most of the providers that you represent do not offer the full line of DME. Some of them do, I recognize that, but these were the original categories that were selected for rounds of bidding. The DME community has had somewhat of a negative history with fraud and abuse, specifically in the Miami areas and some of the Texas areas, with television advertising for mobility equipment, which effectively suggested this is free, and it seemed to create incentives for unscrupulous suppliers to put durable medical equipment into the hands of the elderly or the disabled that perhaps was more than what was prescribed, or else it was completely fraudulent. And I'm sure you have heard of the issues. So how the program works is by legislation, and until legislation changes, this will continue. Every 3 years maximum, these competitive bid areas have to rebid for the business to allow new suppliers in. These contracts are not continual, they expire, and we start all over again. Now, there have been a number of analysts, including Ronda and myself, that have said the program is flawed in that the auction methodology, and it is an auction, without getting into too much of economic detail, that the prices for the reimbursements had to go down. The government was putting ceilings for the current fee schedules that bidders must bid below, hence the savings were virtually guaranteed and automatic. Years over years, they dropped the fee schedule because they applied the fee schedule amounts to the competitive bidding amounts. And again, I'll show you that process shortly. So the prices were going lower and lower and lower, and there was argument from auction experts and economists that this is going to blow up into access issues for patients because not enough suppliers would be willing and able to supply DME products. So what has happened is we have, for our advocacy efforts representing until recently the DME community, but now the orthotic community, the number of DME POS locations has drastically dropped. These are by NPI locations on your screen. In other words, rooftops. So by way of example, in California, hangar would count once and not 16 times. And so you'll see what the differences are among the states. I'll just click through these. No matter what state there are, we've lost about a third of the locations that are supplying orthotics, prosthetics, and DME. And VGM has used this visual here to go before elected members of Congress as well as those appointed officials in Medicare in Baltimore and said these programs that have drastically decreased, and for the DME side, decreased up to 65%, the rental reimbursements have decreased to about a quarter of the locations. Now, these are, again, various supplier types. So if you'll notice, I have selected 6 or 7. Oxygen is separate from pedorthic. Pedorthic is separate from prosthetic. Prosthetic is separate from orthotic. And for those of you that employ CPOs, you've got your primary supply type might be prosthetic and orthotic. And then you've got the respiratory companies, the pharmaceutical companies, or pharmacies, and so forth. But as a testing mechanism, or for our hypothesis, we had pushback from elected officials and as well as from CMS officials that the nature of the mature industry of DME POS, this is a normal decrease. And we said frequently, but not always, but frequently the same population of patient types is represented by pharmacies. And if you look at the bottom, pharmacies have stayed virtually exactly the same. There might be more Walgreens and more CVSs and versus the mom and pop owned, but it still has stayed the same. So in any case, let's get back to around 2021. The DME was on the bidding schedule. There was a reduction for non-invasive ventilation because of the COVID, but what was surprising to the entire DME and POS industry was that CMS utilized a new auction method, of which I'll quickly explain via a diagram. And interestingly, the DME categories received very, very, very little savings because of the approved auctions. However, and you all are no stranger to this, there was 2 years of scrutiny of off-the-shelf back bracing and to a lesser extent knee bracing. And so I'm not telling the good group from Copeland anything they've never heard before. There were lots and lots of arrests. There was lots of fraudulent uses of Medicare cards. There was lots of unneeded supplying of these off-the-shelf braces. And so the dollars were added into the billions into the fraud, and we that are stakeholders fully expected that the bracing would continue even if the DME was not. And so there was a release in late October that said we're not going to bid the DME and the respiratory and the mobility, and we're going to allow some additional payments as long as the COVID-19 public health emergency continues. And when they wrote this, which was back at the end of October, they did not know how long the epidemic was, or the pandemic was going to last, so they wrote it for April 1 or the date following. Ronda and I believe that there's going to be 3 more 90-day extensions, so we're looking at the end of 2021, early 2022, and this is relief for the DME. However, let's real quickly, we'll move on to off-the-shelf bracing. We had lots of bids for the DME and the respiratory, but there was still a $600 million savings because the bracing had never been bid before. So by way of mathematics, the government knew there would be savings because you had to bid under the current fee schedule applicable to the competitive bid areas, again, of which there were 130. Now, if there wasn't, and we don't know the exact number, but there are some areas where it was less than 5% savings where the administrative costs might outreach the decrease in the new fee schedules. They're called the single payment amounts for the bracing. So about a dozen of the 130 had one or the other not included in competitive bidding. So in other words, any orthotic supplier that's accredited and is in good shape with Medicare can offer them. And there is on the DMEcompetitivebid.com, and again, these slides will give you links when you download them. We know how many contract offers there were. So I just was visiting with a group in Houston, of which there were probably 150. I think that's the fourth largest city in the United States, authorized suppliers. But if you look, there was a drastic reduction in the amount of contracting, such that many of these suppliers are out of the off-the-shelf business. So if you want to know what the payments amounts are in your dozen California CBAs or any of the United States CBAs, of which there are 127 that include one or more braces, it's simply at DMEcompetitivebid.com and click on single payment amounts, and you'll get the fee schedules. Now, here's the problem with this program. The new program, and I'm going to show you a diagram in a second, allowed the suppliers to not get the average of all the acceptable bids as was done in previous rounds. And so if there were suppliers that bid very close to the current Medicare reimbursement fee schedule, the highest one in, if there were, and I'll show you the formula of how this works, would receive that amount. But if the areas of the country of which there are either very large suppliers or very few suppliers bid very low just to get in, hoping that higher bidders would pull them up, the average went away. The program did not work with an average, it worked with the highest bid in. And look at the difference for this back brace. If the same widget back brace is reimbursed for $1,100 in North Carolina, it's $200 in LA. And that's why this program is broken. So again, some of the areas did not have any discounts or minimal discounts, and they did not bid them. And Ronda and I believe that's less than 5%. So let's just show you how this thing works, because I do not think you will ever see prosthetics bid. Prosthetics are, and I use really informal terms, and Ronda's heard me say this before, there's a yuck factor with elected officials watching our wounded warriors come back from overseas needing these prosthetics. And I recognize they're not Medicare age, but there is an inherent disgust of having the lowest possible bidder serve our wounded military and veterans and so forth. So I doubt you will ever see prosthetics ever, but I think these off-the-shelf braces are here to stay. So here's how it works for those of you that might enter the bidding next year or have already done. First of all, they go through a supplier check to make sure you're in good hands. In other words, you're accredited, licensed, and so on and so forth. And they will accept your bid by a dollar amount for a lead item brace. And the codes Ronda will go through in a second here. The discount on the one most heavily reimbursed or heavily utilized brace, let's say it's 20%, would then apply to the other off-the-shelf braces. They also receive a reduction of 20%. They offer you via an electronic spreadsheet the anticipated need for these knee and back braces for 1 year. So let's just change the term to widget and say perhaps we need 1,000 of them. They'll simply take per the 130 bid auctions, the lowest bidder who is in first, as long as it's not bidding a penny. There is what they call a bona fide review. You can't bid a penny, but you can bid obviously up to 80% off. I think they test this by invoicing, and they simply ask the supplier electronically how many units you are willing to offer. It's not a maximum of what you can be reimbursed. It's an estimate that has somewhat historical parameters that if you've done 100 before for the last 3 years of a certain brace, you can bid 100 or perhaps 120. But in any case, they add those numbers up from the lowest numbers to the highest numbers. And once the higher bids consecutively by units reach the amount of what was perhaps needed for the estimate, the auction stops and that's the price. Now what's happened before this year of 2021 for the DME, they took the middle one. So I just made a widget here. I don't care what this is. It could be a walker, it could be a knee brace. There is, it's a $100 item, and the first few bidders bid so low they got thrown out. But the first bidder that bid $50 in red offered 550 pieces when we need 10,000 pieces. And so we just array them from low to high, and when the 10,000 is reached, the last bid in was 76.50, and then previous to the round where the orthotics were included, they took the middle bidder. Well, everyone said that just makes people bid low because they think they're going to be brought up by the higher bidders. So they changed the auction to clearing price. Clearing price would be the amount of that highest number in. So in other words, it would look like this now. So while the lowball bidders were in the program and would get an offer of a contract, they had the ability to be paid at $76.50 or much higher than they actually bid. But the problem, as you see, is in areas like Los Angeles, California, that widget was lowball bid by perhaps large suppliers that had to put in large amounts of units, or they were just trying to game the system, hoping someone would bid high enough to get them close to the original fee schedule. Well, it backfired on them. And again, look at that. That I graduated beaker got full for this back brace at $200 in Los Angeles, but it went all the way to the bid limit of $1,100 in the Eastern Seaboard. So the program's still broken. It's my opinion that if this program's going to continue for these braces, I think you should be paid what you bid. That would have been impossible 50 years ago with 30 different fee schedules for LA, but now with software and hundreds of private insurance plans, the computers can handle 30 different prices by 30 different payments by suppliers. That's my opinion. We'll see what happens. So before I hand it over to Rhonda, I want to talk to you about the areas of California that are not bid. You've got a dozen competitive bid areas, and you're familiar with them better than I am. But the program by legislation also called for further savings that used the single payment amounts, the bid amounts of the cities that are bid, their CBAs, and they were averaged for the rest of not just the state, but the region. So let's take a look at those regions. You're in the far west region. And by the way, these regions are mirrored for the unemployment data. So the government simply used a current regional acceptable breakdown. So Ronda and I are in the plains. And by way of example, if we want to be reimbursed for a month of oxygen therapy in Waterloo, we inherit Minneapolis and St. Louis and the other cities within our area. You are in a four-state area where you're going to inherit in California the other competitive bid areas of Seattle and Portland and Las Vegas, plus your own 12 CBAs. So by way of example, and again, I'm going to use the word widget again, if those 14 or 15 areas have an average of $100 for a product, those non-bid areas are going to get the $100, and it's any willing supplier. So again, this program is broken. We don't like it, but I don't think it's going away because the savings and the pay for are so high that virtually cut the DME POS spend virtually down by 40%. So last week, some of you on this call actually are orthotic off-the-shelf suppliers, and I know that many of you or some of you might have bid. There was a bid surety bond required to make a pay-for-play attitude that economists and auction experts suggested would keep some of the fly-by-nights out if you had to buy a $400 or a $500 bond. And that was per CBA. And the intention was to keep small, perhaps unscrupulous orthotic suppliers from bidding the entire state of California and drop shipping the braces because you had to buy one bond per CBA. So in any case, if you did, if you bid on the DME and those things were dropped, you don't get a refund. If you bid on the braces and you were in the upper half of my beaker, you could not accept the program, but you still did not get a bid bond refund if you did not get a contract. So again, premiums were all earned. There were no refunds regardless if you got a contract or not. Last but not least, before I hand it over to Rhonda, for those of you that did bid, the government is allowing through its contractor the equivalent of a Freedom of Information Act for yourself. You had to submit your balance sheet and your income statement and your cash flow and a whole lot of other good stuff to get in this program. If you want to see how the government ranks you among your neighbor suppliers, there is an area on connection that I'm just going to go through quickly that you can click on by using your bidder number to click on my bidding results. You can view and you'll see how you did. It's kind of the equivalent of downloading your FICO credit score if you're an individual, but some of you that are managers that would like to see what the government interprets your financial strength, it's all here for you. And a lot of suppliers, whether they be DME, respiratory, or in the orthotic side, did not know this was available. So I'm going to take a breath, and the rest of the program will be with my colleague Ronda, and I will let her chime in. Thank you.
All right, perfect. Thank you, Mark. And I want to reiterate what Mark had said. Thank you for having me on with the presentation today to share this information that Mark and I have been working with and on and dealing with for many years now. So as Mark had alluded to, these new payment amounts went into effect for those that had a contract in those CBAs on January 1. And it was for the knee and back braces, which I'll show you the codes here in a couple of seconds. And then we'll talk a little bit about how this affects hospitals and physicians and how that those two areas can be exempt. So as Mark had already said, the 13 payment categories that were initially in it were removed, so it's business as usual. However, they will still be paid at that single payment amount that was already established within those territories. As far as the back and knee braces that are off the shelf, you see the codes on the right side that are included in round 2021. So it's not all of the HCPCS codes that exist for the back brace category or the knee brace category. It's a select few of the codes that in legislation it says that these are the codes that require minimal adjustment. So that's why they're in this round 2021. So again, those suppliers will get paid based off that patient's zip code that's on file with the Social Security Administration. Again, as Mark had said, it's not off the supplier's location, it's the patient's permanent address. So let's talk a little bit about some of the contract obligations. And these are the same contract obligations that other DME suppliers were having to work with and abide by in the past. So some of this may be new to you if you're new to competitive bid. And if you have dealt with it in the past because you were part of the other payment categories, it's the same contract obligations. And so the biggest one is when you sign a contract to say, yes, I will be a contracted supplier of the knee and back bracing categories, that means you do accept assignment. That's the only way that you are able to submit a claim with Medicare fee for service for those HCPCS codes in those categories, is accepting assignment. And you do have to take those patients on, you cannot refuse them. You have to accept those patients because you accepted the contract. Some of the other contract obligations are still following through as far as gathering the documentation, following the medical policies as they're outlined for those product categories. So you're doing all the intake process. So you still have to gather this information and follow the same rules and guidelines as far as having the medical records, having the order, and being compliant with those programs. Some suppliers will subcontract out, which is acceptable if you want to subcontract out. If you do that, if you are the contract supplier and you subcontract it out, that subcontractor is literally the delivery person of the item. So they're not the one under contract. It would be your company that has that contract. Some other contract obligations that are important to know is that one big one is that you cannot discriminate against Medicare beneficiaries. So what that means is if you're going to provide a brace to all of your patients, you have to treat Medicare patients the same. You can't provide Medicare beneficiaries one type of brace and everybody else another type. And then obviously you have to furnish all items that are under that particular contract. On the next slide, it goes into a little bit more about orders. And what this particular requirement is stating is that when a doctor, a lot of times a doctor gets brand specific, they may want a specific type of brace. If you as a DME supplier or as an HME supplier, you don't have that particular brace on hand, there are options for you. You can work with the physician to see if there's a comparable brace for that patient. So you would have to get a new order in that case. Or if it's really, you really have to have that specific brace for that patient and you are not able to get it, you can refer that patient on to another contracted supplier. So there are a few options there if it gets that specific on a brace. But keep in mind, the one thing that I always stress is that when it's a brand specific brace on an order and that changes, you have to have a new order to make sure that you're providing the proper brace and then you're able to submit the claim properly. A few other contract obligations are, this one talks about being prohibited, so that just be careful if you have some changes in there. You don't want to get kicked out of the program, which I know any of you don't want to worry about, don't have to worry about that. But you can still have some changes within, and it's a typical process you would follow if you do a change of ownership of some sort. So you would follow those guidelines. Let's move on to that next slide and talk about the annual report that has to be provided. This is something that has to be done twice a year. Suppliers that have the contract have to provide this report. It's all done electronically through the connection portal that Mark had already mentioned. They call it the Form C. So this is where you have to update the type of products that you're providing under that contract. So the suppliers that accepted the contract for around 2021 did that Form C in December of 2020, and then the next due date will come this summer. So it'll be about June when suppliers will see a notification come. On the next slide, so that's really all the contract obligations. There's more in detail if you want to go to that website Mark had mentioned with the DMEcompetitivebid.com. They have a lot of good information out there. As far as what this slide's talking about is the hospitals. So many suppliers are part of a hospital system. If the supplier that is part of the hospital system under that health system umbrella did not get a competitive bid contract, that supplier cannot bill for those products because they are not contracted when they're in a competitive bid territory. However, that hospital can bill for those particular knee or back braces if it's for one of their patients they're working with. This has been something that's been around in the previous rounds of competitive bid, except it was walkers and wheelchairs that were part of this exception. But before around 2021, it is the knee and back braces. So a hospital can provide that product as long as it's obviously one of their patients that needs it, they bill for it. But the DME supplier that's either affiliated or owned by the hospital can only provide it if they have the contract. Otherwise, they would not be able to submit that claim. So that's what that exception is talking about. If we go to the next slide, Then it talks about how the hospitals can bill for that particular HCPCS code that's part of competitive bid, where they would add that J4 modifier. So then Medicare knows what the situation is. On the next slide, it talks about some exceptions to physicians and your PTs and OTs. They have an exception as well, where they can provide an off-the-shelf knee brace and or back brace. And on that next slide, it talks about those exceptions to the rule, where they do have to be enrolled as a supplier, where they can then submit the claim for that competitive bid code, as long as they're dealing with their patient. Obviously, it's a patient that they have been working with and treating, and they need that particular product. And then the next slide talks about how they would submit that claim. That first bullet point talks about which modifiers they would append to that HCPCS code to show that it's a brace that they're providing and what the situation is, so that they get paid properly. Then we finish up, actually, I believe, on the last slide. That kind of wraps up a little bit on the competitive bid part. I wanted to mention, or Mark and I wanted to mention, some sequestration updates, because this affects the entire healthcare community. So your physicians and hospitals and the DME, HME suppliers. As you all know, during this public health emergency, the 2% sequestration has been on what we call a pause. It started May 1 of 2020 and was initially set to expire at the end of 2020. So it was only temporary during the year of 2020. At the end of the year, last year, there was some legislation that was passed. You can see where that's the HR 8158 that extended this temporary elimination. So that pause continued to be in effect until now. It's March 31st of 2021. And that is still set to expire as of March 31st of 2021. There is some activity in both the House and the Senate that is trying to get this pause extended through the public health emergency. And you can see the corresponding bills that have been introduced by the applicable U.S. senators and representatives. You can see the names and the bill numbers. You can also go to their websites, and they have discussions about these particular bills where they're trying to get this extension through the public health emergency, and which we know is important because it does add that, the additional 2 points on your end when you see that reimbursement. So we thought we would share that with you because this is important news that you all know about, and know that it is currently set to expire at the end of this month, with hopes of that getting extended through the public health emergency. It looks like there's some good ground that's being covered, but nothing's done until we know that it's officially signed over. So that's what we're waiting on. And then I think that we kind of wrap it up now, where we get to ask or see if there's questions.
And I wanted to offer, Rhonda, this is our cell phones. We're all working from home now. And it looks like the OPGA and the BGM group will continue to work throughout most of the summer, if not into the fall, from home. So anyone on this webinar today, please jot down those cell phone numbers. And if you have specific questions or things you'd like us to look at, feel free to email us. It's firstname.lastname@vgm.com. So I will take a breath and let our colleagues over at COPA see if there's any questions.
All right, thank you, both Mark and Rhonda. That was very succinct, but a lot of information to take on.
Yes.
I'm sure you're familiar with that feedback too. So currently we have you guys also pull up your chat boxes just to make it a little easier to read through. Rick Riley had a question. He said, for round 2024, could we see an increase in SPAs if the bids are higher? Or will the existing 2021 SPAs still influence the reimbursement amounts?
That is a great question. Currently, it was the fee schedule that determined the single payment amount caps. So in other words, if the brace was $1,100, suppliers in 2021 had to bid less than $1,100. Now, because of this regional influence, the averages of those competitive bid single payment amounts within, I think it's 15 cities in your far west region and 5 for Ronda and I in the middle of the Midwest region, that will set the new bid limits for 2024. So if the new bid limit, by way of example, is higher than your average or than your current CBA because of the regional influence, the prices could go up. However, as Ronda and I have monitored this for 12 years, we've never seen the prices go up. And this year, when they allowed the bid ceilings to revert back to the old pre-competitive bid fee schedules, so the widget that was being paid at $50 across the country due to competitive bidding went back to $100. We saw increases, but again, those items were dropped from the program. So to answer your question clearly, it's very unlikely the prices will go up substantially, but because of the regional influence, these regional single payment amounts, a certain area in California could go up because the new ceiling is an average higher than the current payment amount. So again, I'll make one more example. If the widget's paid $100 in Portland and $50 in LA and $90 in Seattle, and you average those out, would the bid limit be $50 for LA? No, it would go up to the average of that regional amount. So it can go up, though it's unlikely.
Okay, thank you. Another question, kind of building upon that, or in a similar vein, Karen Warner is asking how can they find out when the next round of competitive bidding will happen, since we've already missed or passed.
Sure.
Most recent.
Sure. Legislation, unless it's changed, and not much is moving now with legislation, as we all know, requires the program to be rebid at least every 3 years. So we should have around 2024 program for bracing, not necessarily for DME, but by law, by bracing, because the program's in effect. The preparation period from traditional rounds of DME is 2 years. So by way of example, at the end of this year, at the end of 2021, you'll start to see updates with regard to being prepared for the program, being accredited, being licensed. It's Ronda, what is it about? About a year ahead of it, the bid window starts, the bid window ends in 60 days, and then...
Yeah, it's about a year or so. Yeah, I think it's about a year, maybe a little bit longer, that they open up that bid window. And that's part of that, that it's such a lengthy process is not only to give you all the time to get your information gathered and submitted by the deadline, but then they also have to go through their evaluation process, which does take time as well. So it's a very lengthy process.
Okay. There's another question about public access to what bidders are actually bidding, both in terms of the amount they bid and the number of units they indicated for their supply. Is there any type of transparency?
We have submitted requests through the Freedom of Information Act, but previous requests for similar asks have been denied. So we are going to, we have the National Home Care Association, which is AA Home Care, which I recognize represents much more than the respiratory and mobility side, but nevertheless have secured the Moran Group. It's a research group to survey actual bidders in all product categories with regard to the amount that they bid and the amount of units that they bid. Because obviously in Los Angeles County, with an 80% difference, the gamesmanship backfired. Either the companies were lowballing and they did not recognize how few units would stop the auction, such that as the price creeped up, it stopped at $200. We are selecting those cities around the country, of which I believe we've designated 15 of them, LA being one, that have outliers with bracing as well as the other products. The other products, they did release what the single payment amounts would have been. By way of example, a month of oxygen or a rental month for a walker. That doesn't affect a lot of your companies. So the answer is yes, it's in process. Yes, it includes off-the-shelf bracing, but it's unlikely we'll get all the granular data that we would have requested through Freedom of Information Act. The results of that research from the Moran Group should be available probably in 6 months or more, and we will share that with not just the DME community, but with the O&P Association, National Association, and the state level as well.
That would be great. Okay, we are quickly adding more questions, which is great. Ralph Nobby asked, can a supplier create a formulary of contract braces that are provided to all contracted insurances, like HMOs and et cetera, and still maintain separate cash pay options?
Sure. Ronda, you want to expand on that? There are many suppliers that have actually, there are some restrictions with regard to notifying Medicare eligible patients that these products will not be reimbursed by Medicare, but Ronda, I'll let you handle that one.
Yeah, so if I am understanding your question correctly, Ralph, is that you want to basically provide the contracted braces and bill those, whether it's Medicare fee-for-service and you have the contract, as well as all of your other contracts that you have with any of the other insurances, the same HCPCS codes. So you're across the board the same, and then any other brace would be a cash and carry type option. You could do that. It can get hairy within the contracts depending on what the language is with some of these other payers. Some of that contract language with some of these other payers can get a little challenging, so you'd have to look at that in detail. The other part of it too would be on your 855S form, if you have marked that you are a supplier of the back bracing product category, that means it's an all-in type situation. So they don't have it separated out just for competitive bid products. So it could be done, yes, you just have to do some homework with that and set some policies in place. And then do your research on your the insurances that you're looking at, any of the commercial plans, the HMOs. So.
And one other thing, Ralph, if you want to email me, we have a lengthy opinion from law firms with regard to if you're going to offer a non, well, even if the patient is Medicare eligible, a cash and carry item, some certain checklists with regard to keeping you safe from any scrutiny from the authorities. It's with regard to noticing if it's on a website that this is a cash and carry item that is not covered by Medicare,
right,
and so on and so forth. There's a lot of rulemaking which says if this is not properly effected with an E, not an A, of these noticing, that you might have to give that product to the patient that's Medicare eligible for free. And that's not their language, but it's effectively for free.
Right.
And that paper is a public document that has been printed in trade magazines. So there's no confidentiality and there's no propriety. If you email me, mark.higley@bgm.com, I'll let you, and I'll also send a copy to our friends over at the COPA Association as well.
Right, and that's a good point, Mark. You got to think about those items that are considered for coverage. The ABN would come into play for fee-for-service patients, for Medicare, or the other payers sometimes can be more challenging than a Medicare contract. So So yeah, it would take more discussion than just on this call. So we'll leave it at that.
That sounds good. Okay, our next question, I apologize if I pronounce your name incorrectly. Tunke or Tony Gorgon is asking if OTS brace is requested by the prescriber, yet you see the patient and they need a custom fit brace by a qualified CPO, who changes the code, and how does that work to keep it on the up and up?
So if you have a prescription from the treating practitioner that's specific to what they want the patient to have, and that's going to change, you need to get a new prescription from that treating practitioner that wrote that initial prescription. You would not be able just to automatically change that. You would have to get a new prescription from that treating practitioner.
Okay, so they'd have to go back to their physician to get a new
prescription
that said
custom. And you can call and have those discussions. The patient would not necessarily need to go back unless there's something missing in the documentation that would need to be there. But if a prescription is specific to a brace, and then the O&P supplier is going to change something on that, where it's not the same one the doctor ordered, you have to get the new prescription, and that would have to come from that doctor's office.
Okay. Tanya Lowe is asking if competitive bidding applies to Medicare Advantage plans, whether it's PPO or HMO.
No.
The easy answer is no. No. They frequently, with some delay, target the current competitive bid rates. But any supplier in good standing can service a Part C Advantage plan, which is, as you correctly said, the HMOs and so on and so forth. So that is not restricted. This is only traditional Medicare fee-for-service.
Okay. Miranda Whitworth asked, where do you see the biggest knowledge gaps about competitive bidding among providers? And if we as a manufacturer would like to help serve as a resource to our clinicians, what type of information should we be supporting them with?
We created a consortium of industry stakeholders, an education website, which because the orthotic community is a new player, it did not include those examples. That is, I'll get the website here in a second, that kind of lays out the education that we would like to see from such vendors of the off-the-shelf orthotics. So it's not just the checklists of how to appropriately submit a bid, assemble financials, ensure your licensing is corrective. It also is some tricks of the trade. This auction is a mathematical function. By way of example, if everyone offered by units double of what they have offered in the past, you're going to quickly cut your price in half. There are ways, I'm not saying to game the system, but to work with the system to increase your reimbursements. And I'll get that website in just a second. I've got to look at it. I think it's dmeeducation.com, but I'll confirm that when I go to another screen. I would urge, and it's not restricted by password or anything, such that you can look at the equivalent of a template for instructions. And this was included by vendors. It included the nutritional vendors of Abbott and Nestle. It included the respiratory vendors of Respironics and ResMed. It included VGM's members. So the template is out there for education. I feel free to copy it and feel free to use it, and feel free to contact Ronda and I for anything else that you might need.
Hey, Mark,
again,
I have that.
Yeah.
I was going to say, I have the website that you're speaking of.
Okay.
It's DME CBP. CBP is Competitive Bid Program, education.com. So DME CBP, education.com.
Rhonda, can you paste that into the chat?
Certainly, I can do that.
Terrific.
I can handle that.
I'm sure you can handle much more too.
Should I stop sharing my screen? Will that help?
No, that's okay. We have our last question is coming from Rick Riley. And it's, have any of the 24 people charged in the billion-dollar fraud been prosecuted or taken a plea deal? And will the government, or is there a plan for the government to ever get any of that money back?
Yes, and I know Mark will talk on this too, but I get the updates daily from the Office of Inspector General, which also includes cases that are at the DOJ, and yes, they're being prosecuted, they are being fined. It's still going on as of today, even though this occurred a few years ago. So they're still dealing with these cases in court. So,
Yeah.
will they get their?
Yeah, I don't know about with regard to getting their money back. A lot of this money went overseas, and as with most judgments, the judgment, is for the amount plus the penalty or even treble. It infrequently gets returned. A lot of this goes overseas quickly.
Okay, well, that concludes our Q&A session. Thank you both so very much for taking the time and giving us such an important talk. There was, like I mentioned before, there's a lot of information to go over, and you guys present it so well.
Our pleasure.
Yeah,
thank you.
Thank you.
Absolutely. So as the chairperson of our Education and Advocacy Committee, I'd like to thank all of our attendees as well for your time and your interest in today's webinar. Certainly to our COPA members, we see you and we are so thankful for your continued support. Please check our website, californiaonp.com, for COPA updates. We'll be announcing our next webinar later this spring, and certainly some more exciting news to come your way. Thank you all and have a magnificent day.